The environment. I talked about the curtain case. The environment, too large, too stimulating, unfamiliar, unstructured, too hot or too cold, too light or dark, too noisy, too many people, reduced ability to adapt to change. These are the perfect environment for problems, and they match our current acute care hospitals perfectly. The hospital is too large. Any of you ever go into health sciences and get confused where you're trying to go? If you don't, you're just not there with it, right? The health science is the most confusing building in the province. Too stimulating. Since when did we honor the concept that when you're in bed asleep that it should be quiet? Hospitals are the noisiest places on the planet. I work in them. And I remember going down to the Miller Center one night. I was on call, 3 o'clock in the morning. I had a person with chest pain, and I asked for the EKG machine, right? So here I am in the middle of the corridor. Plunk, 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 plunk. This is the ECG machine with the wheel that was, the bearing was gone in. Plunk, plunk. It woke up everybody on that floor. Now, all they had to do was fix the wheel. So if you got a culture in your institution that emphasizes quietness and sleep, which is what we should have, that would never be allowed to happen. So I remember getting frustrated that night. Here I had this patient with chest pain, and I listened. I said, okay, I just woke up 50 people. Did I do more harm tonight by waking up those 50 versus the person who was there who didn't have significant chest pain, it turned out? Right? This is the sort of stuff. Unfamiliar. There's nothing familiar about acute care hospitals. Unstructured. Totally unstructured. Everybody's there's strangers walking up. There's visitors going back and forth. The visiting hours are flexible. You got people, codes getting called in the middle of the night. Crash carts running around. It's the most chaotic place in the world. So it shouldn't surprise us that people with dementia and acute care hospitals are a nightmare. And we've got to get our hospitals designed to look after people with dementia better. In places in Australia, they have dementia units now. They have delirium units for people who need that environment that's quiet and nurtured. Geriatric units, or specialized environments to look after people with these need sets. Too light or too dark. Any of you who have been in a hospital realize that there's no such thing as night and day. If I put you in an acute care hospital in this province in a week, you wouldn't know if it's night or day. That's how confused you would, because there'd be somebody checking your blood pressure if you were sick. And if you're in ICU, it's really they found that they had to put windows in ICUs to keep people oriented. Because if they didn't have windows, people would get ICU-itis. People in coronary units would get CCU-itis. They get delirious because they didn't know if it was night or day. That's how much their biological clocks get pulled up. Imagine how you put a demented person in that environment. Right? So the environment is really important. When we have environments, we have to make sure that those environments are designed to look after people with dementia. So, what is the best environment for a person with dementia? Their home. It has all the light that they're used to. They know where the food is. They know where the bathroom is. They can walk around on rote memory and figure out where things are. The problem is, as the dementia worsens, the home may become a dangerous place for them. There's stairwells, there's cluttered furniture. So one of the things we've got to get better at is making our environments safe for people with dementing illnesses. And the way we do that is we look at the lighting, we look at rails, we look at stairwells, we look at how can we put things on a familiar level, the entrance, the steps, the rugs, all that sort of stuff, footwear, how do we meet their medical needs, vision and hearing, how do we meet their mobile needs with arthritis and whatnot, so we can maximize their functionality. Because like I said, if you maximize functionality, what happens to the behavior? It improves. And if the behavior improves with maximizing the function, the caregiver got an easier job. If the caregiver got an easier job, the world is a happier place. People can live out their dementias in their homes, and I don't think anybody would want anything different. As you or I, and we're dealing with this illness, we want to be in our homes with our loved ones, in a familiar environment, right to the final day if we can do it. And I think that's most of us would say that, wouldn't it? I think that's a reasonable assumption to make, wouldn't you say? Yeah. Too many people, you've got to keep the circle of care to a reasonable circle of care, because otherwise it's too agitating. And reduce the ability to adapt to change, like I said again. A person with dementia can't change how they respond to us. Their abilities to adapt are very limited. But we can change, so we can adapt. Now, I'm a broken record on that, but I got to keep saying it, because that's happened to me. I've incited aggressive behavior in patients under my care. And I've learned now how to avoid doing that. So that's important. Now, is there anybody online there, Liz, that has any questions?
There's somebody on the phone.
Can I interrupt and just say if there's any?
Sure.
Is anybody there got any questions online? Melinda and Patricia, can you hear me?
Yep, we can hear you. We're okay.
Have you got any questions?
No, we're good.
So you're following things along?
Yes.
Okay.
We can hear you very well.
Very good, thank you. Okay, so the environment, too much stimulation, too little stimulation is just as bad as too much. Televisions are really bad for too much stimulation, but then not having anything in the room, having a bland room with no stimulation is equally bad. You walk in and everybody's sitting in the chair with their head down like that. And then one fellow walks in and he's upset. And guess what happens to the 20 people who are there like that? They all get upset. Then you got a World War II going on, right? So one of the things we're trying to do in our pavilion is brighten the place up. We're trying to get some, I'm trying to get some local art in there. Got a garden going on the outside, but still, it can't happen fast enough for me. But you know, the most valuable people that you have in your nursing homes are often the rec therapists. When it comes to dementia care, rec therapists are really good at distraction because they know the things that people like doing. The social interaction. People are social. I mean, you can keep them in a social interactive thing, and they can buddy up with some people, and you keep that circle of care like that. Fantastic. One of the things that settles down the veterans in our institution, and it never ceases to amaze me, Christmas time, we have a tree. And when we're putting the tree out, we have the veterans cut out, like you would in early school days, a tree. You cut out your tree, and your picture goes on the tree, see? So your picture goes on your tree. But you got to cut it out, and you glue it and all this sort of stuff. So the boys are up there doing up these things. And you never saw, the rec therapist is there, and they got the Christmas music going in the background. The place is harmonious. There's no negative behavior. People are doing stuff. They're into the Christmas mood. They know it's Christmas. They see the people going around, you know, Christmas things on. The staff are all dressed up like, you know, elders and whatnot. And there's harmony. Now, why would that be? And then Christmas is over, and then you get people sitting down, and then somebody comes, and then everybody's agitated. You've got to have good rec therapy 24/7 in your institution. The Newfoundlanders are very social people, so trying to get in local talent, playing the accordion, having little dances, that sort of stuff is very good distraction therapy. It keeps the purple people functional and keeps them going. So you can do that in your home too. I think one of the industries we might be able to develop in this province in the future, given that we have one of the most aged populations in Canada, is instead of axing out our rural communities, make our communities dementia communities. Have dementia communities situated throughout the province so that people can wander in these little communities and have a social network that looks out for one another. And I think that might not be too far-fetched, because coming into St. John's with your dementia may be the worst possible thing you could do. Because guess what? You're going to a big place, you got too much stimulation, right? You got too many people. All the things that I was talking about on this slide right here, unfamiliar, unstructured, too light or too dark, too noisy. All these things people are going to be exposed to if they made the decision to leave their rural community and come to St. John to live out their dementia. Because they're building all these high-rise places, right? Whereas if you're in the rural areas, the people in the community know you. You've got a circle of friends. If you walk outside, your neighbor knows that you're outside, and they probably know that you have a dementia, and they look out for you. In fact, they probably walk you back home. So there's that sense of community. So I think we're going to have to start rethinking how we think about dementia care. Because our institutions are full, so we're going to have to push back into the community more heavily severe demented care. And the only way we can do that effectively is we got to have a community-based approach to it. Because we have to keep people at the highest level of function. And the only way you can keep people at the highest level of function is you got to let them outside their house. If you keep people in their house, if I put you in your house in the wintertime and you don't get out, guess what happens to you? Your quads waste. By the time spring comes around, I can barely get you out of the chair. I got a fellow now who's 97 years old. His wife died Christmas. Came in to see me the other day, asked him to do a get up and go test. Get up and go test. You sit in the chair, get up and walk 10 paces, come back. He couldn't get out of the chair. because his quads were too weak. Because he's been home all winter, he's afraid to go out and break his hip. Because his wife broke her hip last Christmas, and she ended up coming to the hospital, and she died in the hospital. So what am I doing with him? Very simple. I got him doing quad exercises. I got him son taking him out 3 times a week. They go for walks. We go around the lake with him now. He came in the last time, and he can hop out the chair and run out just as quick as I can. Because he got his muscle built up. And he's feeling better, and if you improve the function, guess what happens? Everything else improves. You don't have to be demented to have that happen. And as you get older, the benefits of exercise are more profound. It's really interesting, yeah? One of the things you say, well, you know, you got to exercise and all this sort of stuff. But when you exercise and you're older, in the 80-plus group, the yields for your health are exponential. So we got to focus on exercise. Okay. Too much too little stimulation. Safety and security. Lack of judgment can affect safety. Right. Maximizing safety allows a person to have more freedom. Importance to balance safety with need for control and independence. Maximize awareness and orientation. Home safety. So you got to make your house dementia friendly. So light is important. Light is probably the most important thing of all. When I think about places where people are demented, it's very important to have good natural light and lots of it, because that gives your brain, which is having problems with depth perception and visual spatial perception, more input data and more reference points that can easily access, right? So light is really important. Home safety, less clutter, get rid of the carpets, those little edges that you can hook your toe in, you gotta watch. You want to have the sharp edges taken care of, anticipate the fall before it happens. You want to make sure that you got something done with the stove so that the person, if you're alone and you go out to do some shopping during the house, they're not going to wander on you. If they're going to wander, they're not going to wander to a place in the house that's unsafe. Okay? Bathroom. There's all sorts of interesting things now, like there are monitors, video systems. I got a family here in the city who they monitor all the medications that their loved ones get. 2 of their parents have dementia, okay? They monitor all of their medications via the brother in Montreal. Now how can he do that? Well, they got a machine that looks at the pill dispenser, and every time the hand goes in, he can tell if mom or dad took their pill at the time they're supposed to take it. So the brother in Montreal is keeping an eye on their compliance, the medication compliance. If there's a problem, and they go to the bathroom, and they don't come out in 20 minutes, an alarm goes off, and they have somebody to check the house to see they're okay. Or, if they have permission, they have the closed circuit TV. They can actually look in the room and see where they are. And you can say it's an invasion of privacy, but if it's in your own family, that might be the thing you need to do to provide the security so that the person can stay in their homes. So I think that's not a bad thought. And this is a family that didn't go into any institutions. They're living out their dementias in their home. And they got the support of the family. So it just goes to show we're in a technological age now. This is stuff that Liz and myself are interested in doing. How do we support caregivers in their homes in remote parts of the island by using technology? So I can now go in your room, your living room, and have a chat with you when you got a problem with mom or dad. And we can have a chat, and I say, okay, did you try this? Did you try that? Okay. You tell me to describe what's going on. I can give you some tools to use. You use the tool. Okay. It's a behavior, but it doesn't respond to medications. Okay. Well, here's what you need to do. Bang, 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 bang. Try this, 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 this. Then give me a shout tomorrow, and we'll have another chat. Then as a caregiver, you're feeling supported. The loved one is getting an appropriate approach to the care, hopefully. And if they need medical intervention, I can lift the phone up and say, look here, I'm just talking to the caregiver. I think that person has the delirium, doc. Get in there. Here's what I would do. Dang, 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 dang. And you might want to do these things to have a look. And you know what? Patients then don't have to go to the emergency department. The doctor can sort them out on the ground. And hopefully we can keep them in their homes longer. That's the research we're going to do. We're going to see if we can bring a remote consultative team to the home, if we can keep you in your home longer.